Good afternoon and welcome to the live Idaho Provider Immunization Education webinar on the new Inventory Not Deduct functionality in IRIS. My name is Carrie Sprague and I'm the Data Quality and Interoperability Coordinator with the Idaho Immunization Program, and I'll be your moderator today. This webinar will introduce you to a new tool in IRIS to help identify and correct doses of vaccines that entered IRIS through electronic data exchange but did not deduct from inventory. Before we begin, I have a couple of things to go over with you. This webinar is being recorded. We want to make sure that you are able to send us questions. We do ask that all participants mute their lines while the presentations are taking place, as we will have time for questions at the end of the presentation. Please feel free to type your questions into the chat box and I will read them after the presentation. As a safeguard, I should have muted all lines, but in case of connection lapses or technology issues, please take a few minutes to check periodically to make sure that you are muted. I will now introduce our speaker, Susie Moore. Susie is a Vaccine Management Coordinator with the Idaho Immunization Program. Susie is responsible for vaccine purchasing, orders, and accountability and has been with the Idaho Immunization Program for more than 11 years. Susie?
Thank you, Carrie, and thank you to everyone who's joining us for today's Idaho Provider Immunization Education. As Carrie mentioned, today's IPIE is going to be on the Inventory Not Deducted module in IRIS, which we are really excited to demonstrate for you this afternoon. So what exactly is the Inventory Not Deducted module? It displays doses administered to pediatric patients 0 through 18 years of age sent to IRIS from your organization's EHR through data exchange, but they do not deduct from IRIS public inventory. The data displayed in the IND module is very similar to the data that was once presented to you on a non-deduct ad hoc report. Thus, the module makes those ad hoc reports obsolete. There's two benefits to organizations with the IRIS IND module. The first benefit is that there's real-time access by your organization. And what that means is as soon as your organization uploads doses administered to IRIS, if any doses aired out and did not deduct, you will have instant visibility to those doses. The second benefit is that corrections can be made directly in the module to deduct from IRIS public inventory. So before we dive into the demonstration of the IND module, I would like to review with everybody some of the most common reasons for non-deduct errors. For example, the first error is an incorrect vaccine type that's selected in your EHR that's submitted over to IRIS. For example, if you administer a dose of ProQuad to a patient, but select MMR in your EHR, IRIS can't differentiate that you really meant MMRV. Therefore, the dose will go onto the patient's IRIS record, but it will not deduct from IRIS inventory and be accurately accounted for. Another common reason for non-deduct errors is that there aren't any doses available in IRIS. It will indicate 0 doses available, meaning your organization has already worked through all of the doses supplied to them. Since there's 0 doses available, there's nothing to subtract from. Another common error is an incorrect lot number. As a reminder, the Idaho Immunization Program references the lot number on the outside packaging. We do not reference the component lot numbers that are referenced on the vial or the syringe. Another common error in terms of incorrect lot number, we see a lot of uppercase O's come across the system. And vaccine manufacturers typically don't reference an uppercase O in a lot number. They're usually zeros. So you'll want to be aware of that when you're entering lot numbers into your organization's EHR as well. And lastly, doses aren't accepted into IRIS inventory before they're administered. So it's very important when you receive vaccine orders or transfers from another clinic that you accept those in IRIS right away. Otherwise, the lot numbers may not be available in IRIS to deduct from. So keeping these non-deduct errors in mind while we go through the demonstration, let's dive into that IND demonstration now. I'm logging into IRIS UAT into our test environment. And when you're logged into your organization, you will find the Inventory Not Deducted module in the Inventory section in the left side blue menu. So it's down at the bottom here. You'll click Inventory Not Deducted. And you'll notice that the IND module has a very different look about it. So as we enhance, make future IRIS enhancements, everything will move towards this new modern look. So to run the IND module, you need to let IRIS know that you want to pull data for a specific transaction date. You can do that in one of two ways, by either selecting from a predetermined date range in this drop-down menu, from either 7, 15, 30 days, or 90 days, or you can select a specific date range. It's important to note that the IND module will only pull a maximum of 90 days worth of data at a time. That's one of the limitations of the module. However, you can go back and look at historical errors that may not have deducted through your IRIS inventory. So for example, let's say you want to look and see if anything administered from the beginning of this current flu season aired out. You could select a date range, say from September 1st, 2019 through November 30th. Now, if you notice on this date range, the calendar tool, because we've already selected September 1st, it will only let us select through November of 2019. So once you select your date range, you'll want to click this refresh list button. And it's important to note that depending on what browser you use, you may or may not get an icon indicating that IRIS is processing your request. For example, if you log into IRIS through Internet Explorer, you won't have an indication that IRIS is working through your request. However, once I press this refresh list button, I'm logged in through Microsoft Edge. It will show you a processing icon and verbiage that says it is processing your request. So you'll notice that my request returned a no unresolved transactions. So what that means is that either no doses were uploaded to IRIS through data exchange during that time, or everything that was uploaded did deduct and there were no errors. So now let's take a look at some more recent transactions. So I'm going to select the last 90 days of transactions that were submitted to IRIS. And I'm going to click that refresh list button. Now you can see we have several doses that were uploaded to IRIS through data exchange that did not deduct. And the page contains about 50 or 60 doses at a time. If there's more than that, you can see in the bottom here that there's a second page that you can go to. And you can navigate back and forth between those pages. So now let's take a look at what information is being displayed in the IND module. In the first column, we have the transaction date. That's important to know because when you're requesting data from the IND module and you're plugging in those date ranges, that's the date that IRIS is referencing, which is the date that the doses are uploaded to IRIS through data exchange. It's not necessarily the same date that the vaccination was administered to the patient. And that leads me to the second column, which is the vaccination date, and then the job number or the job ID. This is relevant to data exchange and isn't a column that you'll pay too much attention to. Then you'll have the lot number and vaccine name. That's what was entered into your EHR and transmitted to IRIS. The patient's eligibility on the vaccination date, the patient's last name and first name, and then the patient's date of birth. Now these last few columns, this is where you're going to make the corrections. But before you can make the correction, you have to understand why the dose did not decrement in the first place. So what I like to do, or what I think is helpful, is to export all of this information into a Microsoft Excel report. And to do that, you come up here to the upper right to this report button, and you can click report. You'll get a pop-up that says you're leaving the screen and you're being redirected to the reports page. We're going to say okay. And you'll notice that your organization defaults to the organization name here, and the report date range defaults to the ranges that were selected in the previous screen. So to run the report, you click the Generate Report button. And then you're directed to the status screen. So the report name defaults to the date range that was selected for the transactions. You have your organization name, the username who requested the report, and the start and finish date and time of the report. If you have a pending status here, you can go ahead and click that refresh button, and it will update when it's complete. And when it is complete, you can click on the hyperlink of the report name to pull up the report. And I've already done that in the interest of saving time. This is the report. Did everyone see? I'm hoping everyone saw how we got to this stage. So we exported the report into Microsoft Excel. So again, it shows the date range that the report captures, when the report was run, your organization, and then more importantly, the same information that was reviewed in the IND module, the transaction date, vaccination date, and so on. And because it's in Excel, you can save the information or manipulate it in a way that makes sense to you. So what I've done is I've copied this worksheet and I put it into a table that makes sense for me. That way I can sort it by patient name, I can sort it by vaccine name, trade name, etc. And what I've done is I've also added a column here called research notes. So what I was able to do is I took this Excel spreadsheet and I made notes and I used it alongside IRIS inventory and other tools that we have to determine why these doses may not have deducted. And I made my notes in this column so that I could go back to the IND module and make the necessary corrections. So for example, we'll look at this flu mist here. It was sent across, and I'll filter this out so we're just looking at specifically what I'm discussing. So this flu mist was sent over from the EHR to IRIS as a trivalent flu mist. Well, after looking at my IRIS inventory, I was able to confirm that we do have flu mist. I do have a similar lot number, but it's off by one code or one digit. So I found out that flu mist quadrivalent as opposed to trivalent is actually in my inventory with a lot number of LJ25 instead of 2S14. So now that I've determined what the correct dose is, I can go back to the IND module and I can make the corrections for this flu mist. So I'm going to rerun my report for that 90 days and refresh my list. And we're going to look for that flu mist. So I'm going to sort everything by lot and vaccine name. So all of these bidirectional arrows at the top of each column will allow you to sort by that column. So we were looking at the flu mist earlier, and we determined that the reason it didn't deduct is because it was an incorrect vaccine type and in some cases an incorrect lot number. So we're going to go over here to our trade name column and our inventory lot column. You'll notice that some of these are grayed out in the inventory lot. In order to make that accessible, you have to first select a trade name and then the inventory lot column will be accessible. So we're going to go down to this flu mist to make the correction, because we've now determined that the correct vaccine was flu mist quadrivalent, and the correct lot number is LJ2514. And that PBF is just a code for public vaccine. It's also important to note, if you're making a correction, like say, for example, we've got Fluzone Quad, the only vaccine types that will show up are vaccine types that have a lot number present on this vaccination date. So we're going to go through here and make our corrections for the flu mist. Which we've got quite a few. So we've made all of our corrections for flu mist. Now to update those and correct them so that they deduct from public inventory, we have to select the check boxes in this column. So this, after we check them, that's telling IRIS that these are the line items we want to correct. Once you've selected all the boxes for the lines you'd like to correct, you scroll back up to the top and you're going to click the Save button. I want to take a look at one of the patient names here because I want to show you something important. So we're going to look at Clearwater 3. So we're going to save those corrections, and it's telling you it's processing. And if you'll scroll back down, you'll notice that the flu mist are removed. So now we're going to take a look at Clearwater 3's immunization record. And we see here that there's flu mist quadrivalent that was administered. And when we edit or when we look at the details of this vaccine, we now can see that the vaccine lot number deducted from public inventory. And we know this because the lot number is followed by the backslash or the forward slash, in public, and the field is not editable. Another indication is that this indicates that you corrected this dose to deduct through the IND screen, and that's indicated by that Y. So then you can go back to your inventory not deducted module and you can run it again. And you can work through all of these vaccines to determine what deducted and what didn't and make those corrections. You'll notice here, insufficient, no inventory. This one is telling us that a yellow fever vaccine was administered to patient named Seven Bonner, and that's not a vaccine that's offered by the Idaho Immunization Program. So what you'll want to do in those cases is you'll want to have those doses just removed from the inventory not deducted module. And to do that, you'll download that Excel report and you'll email it to us indicating which doses you need us to remove from the module on your behalf. And that is pretty much a general overview of how this module works. Are there any questions so far?
Is there, one of our questions, is there a preferred browser? And Susie, I'm going to go ahead and answer that. Iris works best if you use Edge or Chrome. With Safari and Firefox, there will be some functionality loss. So usually Edge and Chrome are the preferred browsers. And that is the only question we've seen in the chat window so far. If anyone has a question, please feel free to send it to the chat window and we can take questions. We had a question, what is the purpose of the X in the far right column on the IND?
So the purpose of the X on the far right column, that's to remove the dose from the module. However, that's inactive for providers, which is why providers are asked to download that report and email it to the Idaho Immunization Program so that we can remove it on your behalf. That's an excellent question.
Susie, this is a question. Will a training module training document be available on the Idaho Immunization Program website?
A training document is currently available. It's on the online provider resource finder, and I can't recall the name of it. The title of the document is Vaccine Accountability and the Inventory Not Deducted module, and it is currently available. I didn't include the link in this presentation because the Department of Health and Welfare is currently reorganizing our website. And so the location might change here soon, but you can find it in the online provider binder.
Thank you, Susie. We've had another question. When we are sending it to the IIP, do we send it to the help desk or where do we send it?
You can send it to the IIP at iip@dhw.idaho.gov, and that information is included in the written documentation that's posted online.
Do we have any other questions for Susie? We'll give everyone a couple more minutes to decide if they have any questions or things they want to see.
If anyone's thinking of questions, I'd want to go over just a couple generic research tips with everybody. When looking into why doses haven't deducted, the first thing you'll probably want to look at is if the trade name and lot number that are reflected in the IND module are in your organization's IRIS inventory. If it is, you'll want to look at a few things, such as, did you accept the lot number before you started to administer it? Are there doses available or are there 0 doses? And is the vaccine name or vaccine type referenced in the EHR correct as it's indicated in IRIS? If the trade name and lot number are not available in your public inventory, then you'll want to look for similar lot numbers. As I mentioned earlier in the presentation, you'll want to look for things like uppercase O's, which may be 0s, or S's that might be 5s, things like that. And then lastly, you'll want to consider, did maybe a pediatric patient who is eligible to receive IIP supplied vaccine, did they really receive a private dose? And with this, that concludes our presentation for today, unless anybody has any questions.
I'll check the chat window one more time, and we haven't seen a chat window. If you think of a question, oh, we did get another question, Susie. If we end up with one that shows insufficient inventory, but we can't find out where it went wrong, what should we do? How do we fix that?
That is a good question, and doses with insufficient inventory are the most difficult to troubleshoot because that's basically a documentation error. I think some tips for researching those is to look at maybe the first few doses administered of the lot to see if they were from a previous lot, or see if there's any gaps in the vaccination dates for the lot to see if those are some tricky ones, but that's where I would start, is looking at the first few and the last few doses administered for the lot to determine if there was another lot that was being worked through in your vaccine storage unit. It's also notable to mention we've had several requests to add lots or add doses to inventory because, for example, like with polio, some clinics have stated they've administered 12 doses out of a 10-dose vial. We won't manually add doses into your inventory because that's part of the vaccine accountability process. Every dose must be accurately accounted for. So the tools that you have available to kind of keep you on base with this is the physical inventory account that you should be submitting at least monthly, which is best practice. And now you have the IND module. So those two tools together, along with the show transaction report, are going to be your best bets in troubleshooting any non-deduct errors.
Does the module make vaccine that may have expired since the IND report was run selected in modules? I'm not quite sure what that means.
I don't understand that question either. I'm sorry.
Neither. If the person who submitted that question would maybe give a clarification, that'd be great. So in the polio situation, do we email and ask for those to be removed off the report?
In that situation, yes, you could. I would also recommend that when a multi-dose vial has first been, the seal has been broken, that each time a dose is administered, you put a tick mark on that. So once you reach 10 doses, that vial can be discarded even if there's some antigen left in the vial. And that will help prevent multiple doses in excess of 10 being administered.
Okay. So if insufficient inventory is a reason and flu expired since then, to correct it, will the expired lot be available to select to correct in the IND module?
Yes, it will be available to select.
If there's inventory available.
Correct.
Right? Yes. We have a pre-made sticker that we put on IPV vials so that once the 10th dose is documented, the staff knows that no more can be given. That was just a suggestion from the chat window.
That's a great, I really like that idea.
And does anyone else have any more questions? And thank you for everyone who's given us a question. We'll give it another minute or so. So if people are typing, we don't cut them off.
And as I indicated earlier, there is written resource for the IND module that is available in the online provider enrollment agreement, or excuse me, the provider resource finder. And that's on the healthcare provider page of our website at immunizeidaho.com.
We haven't received any more questions, so I want to thank everyone for their participation and attention during the webinar today. Another thank you for Susie for demonstrating the inventory not deduct functionality and how it will help all of us with vaccine inventory cleanup. This webinar will be available and posted to our website soon. So I want to thank everybody for their time this afternoon and have a wonderful day.